Welcome to Expert Speak on Managed Care and Mental Health, a presentation by experts. Here's a brief overview. The topic of discussion is managed care and the care of mental health. Managed care was put into place by insurance companies to protect patients. Until managed care, practitioners had no incentive to restrict services to necessary service. The purpose of managed care is healthcare cost reductions, monitoring and coordinating care, preventive care, and cost effectiveness. Ethical concerns for managed care is interruption of care when a patient needs to be referred to another practitioner. Patient-caregiver relationship can be affected by the incentives of the caregiver to cut the costs. Confidentiality, because many of the insurance companies require confidential information in order to process. Last but not least, disparity of mental health care. Possible questions that could be asked are: do practitioners feel restricted by managed care? And what services does the caseworker provide? Nathan Hamlin is a case manager for XYZ Insurance. He has a master's in social work. He got his master's at the University of Minnesota Nevis. Nathan was a social worker at the University Hospital for 15 years and was a case manager at ABC Insurance for 13 years and has been with XYZ for 7 years. Eve Clark has a PhD, is a professor at the University of Iowa, and also has a private practice. Her master's and doctoral degree are from the University of South Dakota. She's had a private practice for 15 years and been a professor for 7 years. Nathan Hamlin pointed out that research on managed care is down. He noted Piotrowski's study that in between 1995 and 2002 there were roughly 27 studies, and then in the years 2005 to 2012 it dropped to 4. Nathan Hamlin coordinates client benefits. He coordinates the care to be sure it is medically necessary, is quality care, and is delivered as efficiently and economically as possible. He also anticipates any care needs to allow the access to the care needed effectively. Nathan's main goal is to make sure the patient's needs are met in the most effective way. Dr. Eve Clark also noted that managed care research has dropped. She's also concerned that negative effects of mental health disorders such as schizophrenia. Dr. Clark argues the managed care gives limited availability to mental health services because practitioners are feeling restricted by the managed care providers. The reimbursement of services has been reduced every year while medical costs steadily increase, which is noted in the article How Managed Care Caused the Mental Health Care Crisis by George Northrup. Small reimbursement for tests and assessments has reduced the testing done during evaluation and treatments. Now, the purpose of the 1996 Mental Health Parity Act was to ensure quality in receiving mental health care. However, there were loopholes that prevented this from happening. Dr. Clark's hope is that the Affordable Care Act will help prevent that. Some final points from our experts. Nathan Hamlin says that managed care is cost effective. There are some tough decisions, but things are improving. Eve Clark says it's restrictive, there's no parity, and can be potentially harmful. But they both agree that the best care for the patient is what's important.